When we talk about Pharma 4.0, it's so easy to get caught up in the technology, the AI, the robotics, all that cool stuff. But the real revolution? It isn't just in the machines, it's in the people who are going to design, operate, and innovate with them. So today, we're going to break down what it takes to build the workforce of the future for the pharmaceutical industry. Okay, let's dive right in. This image you're looking at, it's not just some slick graphic, it's the new reality. We're witnessing this incredible fusion of super complex biology with the clean, hard logic of digital code. And listen, this isn't some sci-fi movie concept set decades from now. This is the actual blueprint for how we discover, make, and deliver medicine, and it's happening right now. But, as you can imagine, a revolution like this is causing a huge shock to the system. I mean, for an industry that is built on precision, on regulation, on processes that have been established for decades, this kind of shift presents a massive, massive challenge. And here's the real twist. The biggest hurdle isn't the technology itself. The AI, the sensors, the automation, that stuff is here. It's ready to go. The real bottleneck? It's us. It's the people. To make Pharma 4.0 actually work, we need to completely rethink the workforce. And that's creating this giant gap between the skills companies are desperate for and the skills their teams actually have today. Just how big is that gap? Well, to put a number on it, right now, there's a staggering 60% shortfall between the demand for professionals with AI skills in pharma and the people who are actually available. This isn't just a small crack in the foundation, it's a massive chasm that we've got to bridge, and fast. All right, so where do we even begin to bridge that gap? Well, it all starts with understanding the brand new roles that are popping up, these new architects of the Pharma 4.0 era. Let's take a closer look at who they are and what they're actually going to be doing. First up, we've got the pharmaceutical data scientist. Now, this isn't your typical data scientist from a tech company. Think of this role as a hybrid, a specialist who has to be fluent in two languages, the language of code and the language of compliance. They're the ones turning these mountains of data from manufacturing lines into real, actionable insights. And their toolkit? It's incredibly diverse. I mean, of course they need the core programming and machine learning skills you'd expect. But what makes them truly special is their deep expertise in areas like bioinformatics, actually understanding the biological data, and what's called regulatory intelligence. See, it's not enough for them to just analyze data. They have to understand the incredibly strict rules that govern every single part of this industry. Next up, we have the automation engineer. So if the data scientist is the digital brain of the operation, the automation engineer is the one building the physical nervous system of the smart factory. These are the people who translate all those digital commands into actual real-world actions on the manufacturing floor. So these engineers, they need a really deep understanding of the industrial control systems that have been the backbone of manufacturing forever, things like PLCs and SCADA systems. But now, they also have to be experts in predictive analytics and designing cyber-physical systems. That's how they build these factories that are smart enough to see problems coming before they even happen. And this brings us to a really fascinating new role. In the pharma world, everything, and I mean everything, has to be validated. In the past, that meant validating a physical thing, like a giant steel mixer. But now, how do you validate an algorithm? How do you prove to a regulator that a complex, self-learning AI model is reliable? That's where the digital validation specialist comes in. It's a brand new and absolutely critical role, ensuring an AI model is just as trustworthy as any piece of machinery. But here's something that's so important to remember. This isn't just about hiring a bunch of tech wizards. In a world where IT, R&D, and manufacturing all have to work together perfectly, these soft skills, they become the glue that holds everything together. Just imagine an IT person building a data system without understanding the strict quality regulations. That could be a disaster. It's communication and strategic thinking that prevent those things from happening. So, okay, we need all these new roles and all these new skills. That brings us to the huge dilemma that pretty much every pharmaceutical company is facing right now. Do you go out and try to recruit all this new talent from the outside, or do you focus on developing the talent you already have in-house? And there are really two clear paths here, each with its pros and cons. Recruiting new people brings in those hard-to-find technical skills right away. But reskilling your current employees, that leverages their deep institutional knowledge. I mean, they already get your products, your culture, and the whole complex regulatory world you live in. And when you start looking at the numbers, the case for reskilling gets even stronger. The whole process of recruiting for these super specialized roles can actually cost up to 50% more than just investing in a program to upskill the team you already have.
And it's not just about saving money. Organizations that actually invest in developing their own people see a 25% increase in employee retention. When people see that there's a future for them at the company, that the company's investing in them, they are way more likely to stick around.
Look, this isn't some theoretical problem we need to solve down the road. A full 70% of professionals in this industry say their jobs have already changed because of AI. The ground is shifting under their feet as we speak. But here's the thing. Even if you reskill or recruit the absolute perfect people, you can still fail if you put them into a broken system. And that's because having individuals with the right skills just isn't enough. To really, truly win in Pharma 4.0, the entire organization has to change. The old siloed way of working, where every department is its own little kingdom, it just won't cut it anymore.
Building the team of the future means you have to intentionally break down these walls. IT needs to be integrated with operations, right there on the factory floor. R&D needs a direct, open line to manufacturing. And quality and regulatory, they can't be a final checkbox at the end of a project. They have to be embedded in everything from day one. And this is where the magic really happens. When an IT professional truly gets good manufacturing practices, or GMP, they don't just build systems. They build better, more compliant systems right from the start. And when the quality teams understand what AI can really do, they can help validate it so much more effectively. This kind of cross-pollination, that's what builds a truly powerful organization. So, after all this work, after defining new roles, making tough choices about talent, and completely redesigning how you operate, what's the ultimate payoff? It's about building a real sustainable competitive advantage, and you do that by putting your people first. The real endgame here is to create a culture where learning never, ever stops. And you do that with practical things like innovation labs, where people can actually experiment and fail safely, accessible online training, and, this is so critical, clear career paths so employees can actually see how they can grow as the company transforms. And the rewards for this kind of investment are huge. You get operational excellence, you get stronger compliance, you get faster innovation. But most importantly, it all ties back to the core mission. A more skilled, integrated, and motivated workforce leads directly to better processes, safer drugs, and ultimately better outcomes for patients. This quote really just says it all, doesn't it? In the end, the technology is a tool. The success or failure of this entire transformation doesn't come down to how cool the algorithm is. It comes down to the capability and the adaptability of the people using it. Human capital is the true engine of Pharma 4.0. So to wrap this all up, it's pretty clear the technology is no longer the barrier. It's here, it's ready, and it is incredibly powerful. The real question that every single one of us in this industry needs to be asking is not what technology should we buy, but who are we going to empower to master it? Because the future of pharma belongs to the organizations that get that answer right.